So we had a case in the last year in which a young man was involved in an assault. He was stabbed in the chest. The helicopter was not involved with this case, but the great local BC ambulance service brought him in stat. We now have this fantastic trauma system. We've been working on this for 5 years to build a system where the patients who are involved in traumas are treated slightly differently for the benefit of the whole department. There's a system where as soon as we know there's a trauma coming in, BC Ambulance gives us the heads up, the red phone goes off. We have an alert system that alerts the whole hospital that there's a level 1 trauma coming in. So we know there's a stabbed young man. I'm on trauma call, so I get a page at home. Beep, beep, beep. Oh, level 1 trauma. So I just go straight to the hospital. The team is assembled, and essentially it involves everything from a social worker to deal with the patient's family. There's an extra cleaner who comes in to clean up so that we can get the trauma room ready for the next case. The ward clerk walks into the trauma room and helps with all the orders so that we don't have to run back and forth in and out of the room. There's 2 nurses at the bedside, plus 1 at the head of the bed, and it's just super organized. There's no yelling or howling. It's just super calm and organized. And we just very quickly walk through the assessment of this guy. And he's obviously, got a significant injury to his right chest. He's bleeding out the wound. He can't breathe very well. The first emerge doc is here. They do a great job of stabilizing the young man by putting a chest tube in his chest and making sure that his vitals are stable. And then I get there, everything seems to be going fine. We say, okay, let's take this young man to the CT scan, which was already ready to go based on the system. They were waiting for him. Over we go. All of a sudden his pulse starts to rise and something's going wrong. Instead of scrambling at that moment, we've already got this awesome system with the massive hemorrhage protocol set up. I phone over to the main department and say, this young man's going to need 2 units of O negative blood, stat, and get me 4 more ready. We get back to the trauma room, and so there it is. There's a cooler full of blood. Quickly hook up another IV. And then we're able to place another couple of chest tubes to find out he's bleeding profusely into his chest, essentially caving in his lungs to the other side of his chest cavity based on all this bleeding. So it's just so nice to work in a system where it's just ready to go. We were able to transfuse blood in these fantastic machines called Belmonts, where put in a liter of blood in basically 5 minutes, or we call them pints or units. So a unit of blood takes about a minute. So he went from a very unstable sick patient, he was basically almost arresting, to back to normal vital signs. And then great colleague Dr. Gorman comes in, takes him to the operating room and fixes his bleeding artery. So all of it nicely dealt with. And then he spends the night in the ICU, cared for nicely, makes sure that they don't have any complications of the bleeding again, and he was discharged a day later.